Independence is such a factor in aging. To hold on to your dignity, be in your home, and know when that doorbell rings that you not only have a professional, but you have a friend, somebody who genuinely cares.
So Visiting Nurses is a nonprofit organization. They've been around 50 years, which is incredible when you think about the changes in healthcare.
Well, I loved VNA, and it was a place where you could really feel you were making a difference.
It's truly a hometown agency. They usually know someone who knows the patients they're taking care of, which I think adds to the level of caring. I have a very high opinion of VNA. They always do put the patient first.
I think of words that I hear when I hear patient stories or their families talk to me, or someone in the community mentions it, and they're words like angels and saviors, and they felt like family. It's that very personal touch.
I've had several personal experiences with visiting nurses. A very good friend was able to stay in her home. She had brain tumors, knew that this was her end of life, but visiting nurses made it possible for her to stay at home. And that's where she wanted to be.
Well, it really all began with visiting nurses when my father, who wanted more than anything else to stay out at the farm, and that meant that we had to hire folks to come in and take care of him. And the first place we went was Visiting Nurses. Visiting Nurses was there at the beginning, and I truly believe that they helped him stay alive and stay in his home until the very end. I will say there were probably 20, maybe 25 people from hospice and visiting nurses at his funeral. They all sat together, and they were right there, right behind the family, because all of them had become family by then.
My dad had health issues. He had Parkinson's, and as my dad's disease progressed, and knowing that he had people who cared for him and could provide the services that he needed at the time he needed it most, meant so much to my brother and I at the time, and to my mom, because we knew we couldn't take care of him at home. And it was a comfort to us knowing that the people who were taking care of him were so kind, and they were doing what we weren't able to do, and they were able to provide kind, tender, loving care to him as he passed into his next life. And we couldn't have done it without them.
Well, I think one of the most greatest ways of determining success of an organization is, did its mission, what it did, make a difference in people's lives? And as I've said before, I think Douglas County Visiting Nurses and hospice care have given people that option to have that care in their home. But they were like angels of mercy, I thought.
I think that Visiting Nurses has made a tremendous impact on the community, because Visiting Nurses really is the community, that they do care for their clients as a family member, and Visiting Nurses is really family.
This community, today, we would not be near the shape we're in if it wasn't for Visiting Nurses.
You really can't quantify what it means to an individual to have someone come into their home where they prefer to be, where they feel safe, they feel loved. It's very unique and special.
And to think that in this world, in our state, in our county, our town, one individual, a woman, and another individual, a doc, can against all odds accomplish what we have today.
It shows me that if you have the spirit within you to move that rock, the rock will move. And they moved it out of the way, and we now have this admired organization